Welcome to this week's episode of Unlocking Access, a podcast created by the Youth Alliance for Sexual and Reproductive Rights. I'm Olivia Stavala, a legal researcher focusing on reproductive rights. In today's podcast, we will discuss one of the most debated topics in the nation right now, access to abortion in New South Wales. We're going to start off a bit technical and go through the legislation and some statistics. However, if you stick with me, I promise it will get interesting. This debate usually focuses on the value of the fetus versus individual autonomy. It's academics like Professor Isabel Karpin who argue the law, science, and pop culture shape the boundaries females are forced to suffer, as the policymakers will often place more value on the potential life rather than women's autonomy. This is why the podcast will focus on the healthcare needs of individuals and the barriers that individuals face to their own autonomy. The Abortion Law Reform Act 2019 made a significant shift in the legal framework as it took the first steps in decriminalising abortions as abortions became part of the public health framework, including Section 12, which has decriminalised self-performed abortions. First and foremost, under Section 5 of the 2019 Act, health practitioners are allowed to perform abortions on a person up to 22 weeks into the pregnancy, as long as they have the appropriate and prior consent. If a person wishes to terminate a pregnancy after 22 weeks, they will fall under Section 6 of the Act, which imposes much stricter conditions, including two specialist medical practitioners agreeing that terminating the pregnancy is appropriate considering all the relevant circumstances, such as any that are physical or social. While both pieces of legislation are a huge step towards New South Wales aligning with modern human rights frameworks in regards to abortion, it does not mean the new legislation has given universal access. One instance or example of how the 2019 Act creates delays and barriers to abortions access is Section 9, as it allows for conscientious objectors by registered medical practitioners. Therefore, it creates more obstacles in areas with already limited access. It was reported in a 2017 study that only 1% of women received an abortion at no cost. 34% of women had difficulty or a very difficult time affording their abortions, and over 68% of women had to use financial assistance in order to cover the cost of their abortion. This just further shows how much more work needs to be done in order to eliminate these obstacles, so that women in every area and financial situation has access to the most basic of medical procedures, and so that they have medical equality in the healthcare system. Now we're going to move on and discuss the very recent amendments to the current abortion law, which was first introduced in New South Wales by MP Jenny Legon Curran. I'm really sorry if I'm not pronouncing that correctly, and was passed on the 14th of May this year, which proposed 4 main amendments to the current legislation. The first major amendment to the current legislation was to ensure that abortion services were provided and available across the state, by giving the Health Minister the authority to compel public health centres to provide abortion services. This is one of the most important changes in the bill, as it endeavours to increase the number of healthcare practitioners who can legally perform early medical abortions, as they will hugely benefit remote areas who have limited access to healthcare already. The second reform that was proposed was to give nurses and registered midwives the authority to prescribe early medical abortions, meaning they will be even more accessible to women, as this will dramatically increase the amount of practitioners who can and are able to give women abortions. The third amendment requires any practitioner who is against giving an abortion to refer the patient to another practitioner who will perform the abortion, rather than just giving the person information and sending them on their way. This will hopefully ensure that people do actually get the healthcare that they need, rather than just being dismissed and sent home. The fourth and the final major amendment to the current law is removing all of the unnecessary reporting requirements that creates barriers and makes it harder for women to have access to abortions. This amendment not only hopes to make the medical procedure more accessible, but also remove the stigma that abortion is a crime and that women that are getting abortions are doing something wrong, especially in the case where a medical abortion is necessary for the mother's health. While these amendments are instrumental to granting access to medical abortions much easier than it previously has been in a real and undeniable way, there are 2 key sections that would have created much more access. However, they were excluded from the final bill. One was to ensure abortions were provided within a reasonable distance from the patient's home, and stronger requirements for conscientious objectors to refer patients to someone who will provide the service, not just provide them with information. Both of these sections would have exponentially increased access to abortions as they break down the existing barriers preventing women from getting the healthcare that they need and require. This part of the podcast will address the Postcode Lottery Report 2023 and international human rights. The Senate Community Affairs References Committee May 2023 report ending the postcode lottery addressing barriers to sexual, maternity and reproductive healthcare in Australia highlighted the geographical inequalities as individuals who live in rural and regional areas face significantly more challenges in accessing basic healthcare due to already limited doctors and modern medical facilities in those areas. This is further supported by an investigation held by the University of Sydney that uncovered that only 3 out of 220 public hospitals in New South Wales offered abortion procedures. Those that did were Broken Hill, John Hunter, and Royal Women's Hospital. This lack of accessibility has serious and very concerning implications for bodily autonomy, especially if there is only limited access to such a basic medical procedure that arguably every person, no matter where they live or their circumstances, should have easy access to. Moving on to the international conventions such as the Convention on Elimination of All Forms of Discrimination Against Women, Article 16E, states the right for women to freely choose the number and spacing of children. Therefore, denying women readily access to this procedure is a violation of their human rights under international human rights law. Furthermore, the CEDAW committee states that unsafe abortion is a leading cause of maternal mortality, illustrating there is an extrinsic connection between access and maintenance of women's lives and health. Despite this, New South Wales still has limited abortion access. Beyond the geographical barriers that limit access to abortion procedures, there are also financial barriers that prohibit access, thus putting restrictions on women's bodily autonomy. A study in 2017 showed that 1/3 of women who needed abortion struggled to pay for the procedure, and more than 2/3 needed financial assistance, showing a fundamental flaw in the current policies and legislation that make it unnecessarily hard for women to access healthcare. Moreover, it was recorded that over 90% of women who sought abortions had Medicare. However, only 1% of these women were able to get the procedure for free. The final part of this podcast will discuss the next steps that need to be taken and future reforms. We believe at the Youth Alliance for Sexual and Reproductive Rights that in order for there to be complete equality in women's reproductive rights and decriminalizations of abortions, there has to be complete and comprehensive reforms. These comprehensive reforms would start with the New South Wales government mandating all the appropriate resources to every public hospital so that they can provide abortion services, especially in regional and rural areas. This is vital as women in regional and rural areas of New South Wales seek abortions twice as much as women who live in the cities do. This reform goes beyond allowing more practitioners to prescribe abortions, as it ensures there is infrastructure in place so that healthcare is universally accessible for all those who need it when they need it. This is a fundamental principle of health equality according to the Ending the Postcode Lottery report. Another vital reform is to change Section 9 of the Abortion Law Reform Act 2019 to include a clear duty to provide and ensure access to abortion services if the practitioner will not perform the procedure. This reform is essential because it would ensure that individual beliefs do not impede a patient's access to healthcare, thus will not create a barrier that impedes a woman's right to medical autonomy. The Abortion Law Reform Amendment Bill 2025 is a crucial step towards reproductive justice in New South Wales. However, it is still a long way from bridging the barriers that women face because legal change must be paired with cultural and institutional support. In order for real change, we need funding, public awareness, and clear professional guidelines for practitioners to ensure abortion is not only legal but accessible and affordable. Further, I implore policymakers to read about the experience of women and commit to implementing reforms that will give bodily autonomy and healthcare equality in New South Wales. By taking a feminist bioethics perspective to make access to abortion services for every person who needs it real and not just theoretical. For more information on how you can get involved, please visit the Youth Alliance for Sexual and Reproductive Rights website. Thank you for listening.